email. He said he didn't see the email, so give him 1 second. He's going to put it up.
Okay. Go ahead and do the introduction.
I'm going to call to order. Today is Thursday, May 23rd, 2019, fiscal year 20, operating budget hearings with the Budget and Finance Committee and Metro Council. Before us, we have the Hospital Authority. I'll turn it over to Dr. Webb. You can do the introductions, and then you can walk us through your budget. The floor is yours.
Thank you, Madam Chair. To my right is our Chief Financial Officer, Bruce Nairmore, and to my left is our Board Chair, Joel Sullivan, and I am Joe Webb, Chief Executive Officer at Nashville General Hospital. And I'd just like to start by saying thank you. Can't hear me? Okay. Get a little closer here.
You can pull it to you.
All right.
Yeah.
Can you hear me now? Okay. Just want to say thank you to the council for having us today. And also thank you for your support of the hospital and healthcare in this great city. I want to say thank you to the mayor's office, Mayor Brawley, and his administration for the support that you've given us. It was certainly pivotal to our sustainability journey. And to our Hospital Authority Board, I want to say thank you for your leadership and governance and your continued support. And last but certainly not least, I want to say thank you to our employees, our staff, some of whom are here today in support of this presentation. I want to thank you for all of the great work that you do and those that could not make it to provide excellent health care to our patient population. Thank you very much. And we do have a PowerPoint. I believe that's about to go up here.
Mr. Jameson's worked on it.
Okay.
You're going to need to walk us through it, Dr. Webb.
Beg your pardon?
You're going to need to walk. If you have it, you can walk us through it.
Okay. I don't know. Do I have enough copies?
I am.
So if you call us an hour ahead, we can get it set up, but it's a separate laptop that we have to get from the clerk's office, and they're all gone.
Okay. All right.
Sorry.
Well, we'll wing it.
Okay.
You have some extra copies you can provide to committee members. You should know government doesn't work that fast, Dr. Webb.
Yeah. That's what I was anticipating.
You can just walk us through the PowerPoint.
Right. So starting here, first page, I will move through this pretty quickly. Just looking at the page with the heading of Nashville's original community hospital, which is what Nashville General is. We're celebrating this year the 129th year. Previously, we had used the tagline, "Here to Stay." As you can see at the bottom here now, we are here for good. And we are looking here at one of our new ads, which you will see about the city on billboards and on buses. It's a part of our marketing campaign. And on the second page, you see a diagram here illustrating at the top what's called the IHI, Institute of Health Improvement, Triple Aim. It is a framework that is put forth by the Institute on an international basis, and for every healthcare system throughout the world, they aspire to achieve the triple aim of healthcare, which are the three components are care experience, population health improvement, and per capita cost. That's our North Star. That is where our goals are based, goals and objectives are based. And if you'll turn to the next page, I will refer back to the triple aim. But if you'll turn to the next page, you can see, I'm not going to go through each one of these, but you can see a list of accomplishments starting fiscal year 2016, 17, 18, and 19, highlighted by our 2 Joint Commission surveys, and the models of care. One item I want to call special attention to is the 4 disciplines of execution, which is what we're using as our performance tracking, monitoring, and that goes back to the triple aim of healthcare. So that discipline is very comprehensive. It's spread throughout the hospital. Already we have seen a tremendous return on that investment, and it is designed to achieve our goals and objectives, specifically focusing on the triple aim. This is a busy page, so without the PowerPoint, I won't take you through every aspect of it. But I will show you the next page, the page that illustrates the distribution of our patients throughout Nashville and the concentration, which indicates that we are getting patients from all over the county. And if you will flip to the next page, you will see a simple trend line. The second item on the trend line representing fiscal year 2018 should represent an amount of $48.1 million rather than 52. We actually utilized $48.1 million during that period. So 51, 48 million, 46.1 million, and 43.1 million in the current in 2020 fiscal year. Now, in healthcare, you don't usually see a trend where the cost goes down. And this represents the subsidy that we have requested from the city for that period of time. So the clear indication is that the city has had the benefit of utilizing taxpayer dollars in a smaller amount through subsequent years since fiscal year 2017 and continuing through fiscal year 2020. Our goal is to continue that trend, and if you'll turn to the next page, you'll see an illustration of the distribution of our payer type for our patients. If you'll look at the left side, you see the heads, the green columns. You'll see that 50% of our patients do not have the ability to pay. Now, that's a commitment that was made by the city back in 1962 in its charter that it would care for that population. So that's what we do. So as a result of that, 50% of those patients that we care for do not have the ability to pay. The remaining 50%, as you see, are distributed among TennCare at 25%, 15% Medicare, and 10% commercial. Our opportunity lies on the right side of this page in our revenues, our revenue cycle, which is very critical that we collect on those individuals that do have the ability to pay. So the opportunity here is to change the ratio, the mix of this payer group into a larger portion of it being the commercial population or the population that has the ability to pay if we're going to continue our trend. Now, that doesn't mean that we're going to not see any patients that cannot pay. It just means that the amount that we're seeing that can, we have an opportunity to grow and increase that and to create a better a revenue flow for us. So if you'll turn to the last page, you will see that one of the things that we are doing is looking at expanding the footprint of the hospital, basically expanding the access points of the hospital. We have opened a small clinic at the Edge Hill location on 12th Avenue South at Garnet Tower, where we partnered with MDHA. It's a 2-day-a-week clinic and low overhead, but it reaches a very critical population, particularly the MDHA residents there and the surrounding community. And also, in June, we're going to be opening a clinic at Midtown on the Charlotte corridor, 1919 Charlotte, that will house multi-specialty services, women's health, as well as primary care. Now, we have an excellent opportunity at this time to decrease the use of the taxpayer dollars for our subsidy by expanding our access points, by increasing the market share, and by growing revenues, which we will be responsible for maximizing and optimizing collections of those revenues. So with that, I will turn you over to our Chief Financial Officer to begin to go through our budget request for this coming year.
Yeah. And I'll just start first with a few of the highlights from the hospital for fiscal year 2019. We had our 2018 fiscal year audit. It resulted in a clean, unqualified opinion, no material weaknesses found. It's a big positive move for the hospital moving forward. We also this year implemented a budgeting software for the first time, and it gives all of our managers, our department leaders, the ability to see their financial information and drill down real time to provide decision data for them to make better decisions and manage their businesses more effectively. Just like we probably said last year, and we'll update it this year, our accounts payable as a hospital are at about 45 to 50 days, compares to about 100 days in prior years, and so our payments are current with Meharry Medical College as well. From a capital investment standpoint at the hospital, we were really happy to receive, with administration support and from the council, a little over $2 million in capital for the 2019 fiscal year. We've deployed that, approximately $2 million so far. We replaced all the rented patient beds in the hospital, all the rented patient pumps in the hospital, and that investment's going to save the hospital $660,000 annually in rental expense. Very much appreciated. Not just good for the patient, but good for our operating line. Dr. Webb mentioned the revenue cycle at the hospital. It's operating pretty effectively right now. We always have room for improvement, but this year we saw our net percentage, so the percent of every dollar that we collect, it actually rose from 17.3% to 18%, and that doesn't sound big, but that's a pretty big move on $230,000 worth of gross revenue. So that less than 1% equates to almost $2 million of pickup there. Our net accounts receivable days, they were about 90 days 12 months ago, and they're down into the 40 to 45 range. So as we are getting paying patients in, we are turning that money around, using that cash, obviously, to pay down accounts payable and try to not have to seek support from the subsidy dollars that we receive from the city. Our 2019 performance and sort of, we look at 2018 actual versus 2019 where we project to be by the end of this year. And just some of the points that we talked about, our patient gross revenue, patient charges are down just slightly. Most of that is related to some providers that were lost with the noise that occurred back in late 2017. Meharry and the hospital have both been diligently recruiting physicians to fill those open spots, particularly in areas like surgery, orthopedics, GI, oncology. Those were areas that were hit pretty hard late 2017 with defections. So we've both been refilling those spots. But our net patient revenue total dollars that we've collected is going to drop from about 40.8 to about 38.1 this year. We project. Other revenues will be about flat with last year. Our funding from the state dropped about $1.3 million this year overall. And obviously we manage on our city supplement to reduce that from $48 million in 18 to the 46.1 that's budgeted for this year. So on the expense line, we're just managing our expenses. We've done a good job on supplies. We've reduced some contract labor in the hospital, nurses, et cetera. And honestly, the stability that's been given by this council and by the mayors, the administration, them being public about supporting the hospital and stabilizing the funding, it allows us to keep employees, retain, also allows us to bring in new ones that aren't afraid that 6 months later they're going to close down the hospital. That's really important, not just for staff, but that's important for both us and Meharry to recruit more physicians. We need that stability. It has been a good year for that. It can still get better. So at the end of the year, last year, we had a surplus of about $4.3 million, which was really paying down receivables. And this year, we're projecting to probably have a small deficit of $2 million. But I say that that's after depreciation amortization, which is a non-cash spend item. So our 2020, the next is a revenue cycle slide. And it just shows how the revenue cycle department is performing. They're supposed to collect 100% of the net revenue from 60 days prior. That's how most hospitals measure their effectiveness. And if you can see the numbers at the bottom, our 12-month run rate is we're collecting about 106%. And most recently in 2019, we're collecting about 123%. That won't hold for that long. But it's still probably in that 105 to 106%. Some of that we discover insurances on patients that originally presented to us as uninsured. So when we reserve for them, we reserved 0, and ultimately we can collect something if they have TennCare or some other form of insurance. Our 2020 budget request, Dr. Webb mentioned it earlier. Just some of the basics. We do have the 3% cost of living for our employees in the 2020 budget. We do not have a step. We're not part of Metro's pay plan. So ours is just a cost of living increase. It's in here, and it's about $1.1 million increase related to that. That being said, with the $660,000 benefit we have from avoiding those rental costs and some other efficiencies, we're actually able to request a $43.1 million subsidy in 2020, which is $3 million lighter than it looks like we're going to have to need this year. Just doing a better job, chasing every expense, bringing in every dollar that we can. So that's our request for 2020. I'm sorry I didn't have numbers up. I don't do this without numbers usually.
That's okay, Mr. Naramore. You did great. Councilman Glover.
Thank you, Chair. Director, so I want to go back very quickly. I'm not going to remember because I didn't write the notes. I think you said 2 clinics. I'm calling them clinics. That could be using the wrong words. But there's 2 external locations that's outside of where the hospital itself is located. Is that correct?
Yeah, one's open and one's scheduled to open.
Is coming, right, okay. Yeah. So on that, because there are obviously a number of people who are unable to pay for services rendered, and we understand that. I mean, that's one of the reasons that you guys exist. By opening, does this create an additional expense? Does it create a break even, or does it actually create a revenue base to help pay the overall cost for the hospital as a whole? If you said that, nope. I didn't hear it.
I'm happy. I mean, I'll just tell you, because I'm the finance guy, right?
Go ahead.
We believe that moving off campus will give us a better opportunity to have a higher mix of insured patients. It doesn't mean we won't see uninsured patients at Midtown, but I would be willing to bet that the mix of patients that access that point will be a better than our 50-50 mix that we have in the current hospital. And truthfully, we've got some of our patients that don't have coverage. They're moving out of North Nashville, and their access points, if you looked at the map, the geographic distribution, we draw people from Antioch, Madison. It's not just right here. I suspect they used to live in the North Nashville area, and they've just had to move out further, but they still need the care that they received before, whether it was from our docs or the Meharry docs, and so they still come. We still take care of them. We're just providing more access points. If I didn't think that we were going to get more paying patients there, I wouldn't have been supportive, frankly. So your question is good. That's the point.
I think it's a question that has to be asked, and so I'll direct this to the hospital, the board versus the administration. How closely is the board monitoring when these facilities, locations, whatever you want to call it, how closely is the board monitoring when it opens what the actual expenditures look like versus the revenues that are generated? Given I'm going to call it a new business when it opens, it's not going to be profitable, couldn't be profitable from day one. But how long do we wait before we say, it was a good idea, but it's not working? Or, great idea, let's look at maybe expanding a few more because it actually is generating revenues to help us cut down the amount of subsidies we're asking the city to help us with every year.
It's part of the strategic plan, so we analyzed it to see how we could increase the revenues at the hospital, because basically the hospital only has one way to raise money, and that's through doctors and
Right.
serving patients and the ancillary services that come along with that. So through that review, we decided that this would be the best step to take to be able to go out into the community where the need is, so they don't have to drive into the hospital. It's more efficient way to serve the patients. Also, with the new budgeting software that Dr. Webb spoke of, we can now track it down to the cost center unit, and we have our finance committee meeting once a month where we review those numbers, look at the revenue and expenses, and it's got to make good business sense.
Yeah, you won't hear an argument from me on that one, yeah. Yeah. Thank you, Chair.
Thank you so much, Councilman Glover. Any other council members seeking recognition? Okay, seeing none. Thank you so much, Dr. Webb, and to the entire Nashville General family. This concludes your budget hearing. If we can have the Economic Development Team come down. Thank you so much for being here.
Thank you.